The first touch point that a navigator has is that initial contact with the patient. However, the navigator gets referrals, and for many of us, it could be, cold calls, it could be calls from other treatment sites and community practices, it could be web referrals, it could be any variety of things. So, the first touch point is establishing that relationship with the patient and, assessing what their barriers are and, are they able to even come down for, CAR T-cell treatment. For instance, if a patient's got a poor performance status and is bedbound, but their spouse wants them to come down for CAR T-cell therapy, having a discussion with the patient and the spouse as to maybe this is not realistic at this time and that they maybe need to get a little bit stronger out in the community before they can come down. Could they make the 2 or 3 hour journey into the city and be away from home? Are they strong enough to do that? So I think, that's a really important touch point, because sometimes patients hear about treatments, hear about therapies, but they may not be in the best position to undergo those therapies at this particular time. So I think, that's an important aspect of contact with the patient. So coming in, getting them through their first appointment, explaining to them what is going to happen at their first appointment, and then taking them through after that appointment what the anticipated CAR T-cell journey is, when they anticipate that they think they'll be able to get them a slot to get their T-cells apheresed and then sent to the lab and re-engineered. What is the time that they will be coming into the inpatient unit, and then, working with the inpatient unit as far as making sure that the patient is set up inpatient, but working with them to make sure they have the proper appointments post CAR T-cell, and they don't get lost in the cracks, because, they could tell a patient, oh, you need to make an appointment on this day and that day, but the patient has no idea where to call or who to call, and they're just so totally overwhelmed. So that, collaboration between inpatient and outpatient is really important as well. So that's an important touch point. And then follow up, making sure that after their discharge, they are coming back for their appointments and that they have an understanding of the importance of their appointments, and constantly reiterating what to report to the physician and just checking in and seeing how they're feeling. There's other touch points too, just depending on the patient's journey. If they're going to be getting CAR T-cells, but it may not be for a while. Maybe they're going back into the community for 3 more cycles of therapy, but making sure they understand that, and then what the next steps are as far as CAR T-cells. We'll get you your next 3 cycles of therapy out in the community. We'll bring you back, we'll reevaluate you, and then we'll, move forward with the next steps. I think the most important time for the navigator to be introduced to the patient is at that first point of contact. Their first visit or before their first visit, getting in contact with me to explain and find out, what they have, where their records are, who they're coming, who they need to see, what kind of treatments they've had. Starting that from the very beginning and building that relationship is really important, because like I've said, patients may call for CAR T-cell therapy, but they may not be eligible for it, or they may have a disease that we're not doing CAR T-cell therapy for, but providing that education is really important. So I'd say from the starting point, building that relationship and that trust with the patient and the family is probably the key point, because you learn so much in the very beginning of talking to a patient about what their barriers are, what their coping mechanisms are, and you can intervene much earlier if you have all that information up front.